Hey everyone, it's Amy from GP Dots. I'm here to talk about an event that we're holding in Halifax in July. It's on the 22nd at 11 o'clock in the morning, and we're going to be meeting at Halifax North Common. The event's called Advocate for Action on the Opioid Crisis, and we're going to be there to make a statement, to educate people, to let the government and everybody else know the things we're fighting for in terms of action on the opioid crisis. These things include education. We need to educate the public, our young people, on the dangers of both illicit and prescribed opioids. We also need to educate people who are already using on how to reduce the risk of their use in hopes to prevent overdose. We also need treatment. We need accessible mental health and addictions treatment. Waitlists are not acceptable, and they wouldn't be for any other life-threatening condition. We also need access to harm reduction measures, things like naloxone, safe consumption sites. We need a wide variety of opioid substitution therapies because one treatment does not work for everybody. These need to be low barrier access in order for the people who need it the most to be able to get it. We're also advocating to reduce stigma. Often drug use is viewed as a moral failing when really it's a public health issue. Our loved ones' lives mattered, and the people who are still fighting for their lives matter too. And we need more people to come out of the shadows and just show that this problem affects people from every demographic, every walk of life, and there's no need for this health condition to be stigmatized. We're also advocating for more cautious prescribing. Many people are harmed from opioids through legitimate prescriptions for pain, and even further stigmatized if they're harmed from their own prescription because they're made to feel there's something wrong with them, not necessarily the risk associated with these medications. We need more cautious and responsible prescribing. We need to stop exposing new people to opioids unnecessarily. We need to better regulate big pharma and their marketing, the conflicts of interest. We need to separate physician education and pharmaceutical influence. And the companies that fraudulently marketed opioids have still not been held accountable in Canada. And I do not want to see, like anyone else, history repeat itself, because it very likely could, with the amount of power and the lack of regulation when it comes to big pharma. We need somebody to stand up and hold them accountable for their role in the opioid epidemic and put measures into place to prevent this from happening again. I hope that we can get lots of people out to support and educate people on what we need to properly address this crisis. And I hope to see you there on July 22nd, 11 o'clock a.m. at the Halifax North Common.